Matthew Lowry had a recent shoulder replacement, and his body wasn't healing properly.
I was experiencing a bulge in my shoulder that was an infection coming out.
When Mr. Lowry came to us, he was experiencing tremendous shoulder pain. He had no range of motion in that right shoulder, and he had a bone infection in that right shoulder.
What Mr. Lowry had was refractory osteomyelitis. Basically, he couldn't keep the shoulder closed. You have bacteria that may be in the joint that just are very difficult to get rid of.
Well, I learned about the hyperbaric through the infectious disease doctors, and they told me that I was a good candidate.
At Ford HealthCare's Wound and Edema Center in Johnson Creek, Matthew was set up with 40 treatments of hyperbaric oxygen therapy over 40 days. Working with antibiotics and surgery, the goal for Dr. Goldman and his staff was to heal the infection completely and permanently.
Bacteria don't like oxygen, actually, so it kills those bacteria. So it works with the white blood cells in the immune system in order to fight this recurrent infection.
So once you put into the equation the hyperbaric therapy, it allows that body to do exactly what it's wanted to do all along, which is to heal itself.
For those not familiar with hyperbaric oxygen therapy, it's truly a unique approach to medicine.
Hyperbaric medicine is an amazing alternative to other treatments out there for wound healing because it is the least invasive treatment out there. It allows the patient to get on with their life faster. When Mr. Lowry came to us, we would do some vital signs before and after and ask a series of questions, making sure that he hadn't changed medications. Safety is our biggest concern.
At first it was a little nerve-wracking, not understanding what's going to happen, but they talked me all through it.
We make sure that we explain to them that they're going to feel some pressure in their ears, which is normal. We kind of compare it to flying.
You got to swallow and swallow and swallow the whole time you're going down. It'll clear the ears out.
When a patient is in the chamber, it sometimes can feel like 2 hours is a long time when you give them that time frame. So we make sure that we have plenty of movies for them to choose from.
Oh, we had the TV on the top of the chamber and watched whatever movie I wanted to watch. The nurses, they always joked around with me. Dr. Goldman, he always had a joke or two he had to tell every day. Kept things on the even keel, so I didn't have to think about really what I was going through. And it all went very well.
Hyperbaric oxygen therapy was the right choice for Matthew. It took time, but he fully recovered from his infection.
Well, Mr. Lowry did very well with the hyperbaric oxygen treatments. And with the control of the white blood cells and making them stronger and working better, all those things in the long run made it so that he could get another shoulder replacement, and this time succeeded. It did not reopen. He was able to do physical therapy and now has full range of motion where before he had none.
Dr. Goldman was fabulous. He helped get everything taken care of, and he worked with all the doctors. He worked with the insurance companies, got it all off my shoulders. I really respect the man. He's a brilliant doctor.
Well, it's very gratifying that after 4 or 5 infections and having his whole life impaired for this problem, to then have a treatment that we could provide and giving him a new lease on life is tremendous. It's the reason why we do this. It's the reason I go to work every day.
My favorite part of my job is to see success. And it was just so amazing to see that transformation with him and how he was able to get his life back.
I just want to say thank you to everybody up here at the Wound and Edema Center. They did an excellent job because they really saved my life. I got rid of the infection. I'm planning on having a good retirement from here on out.
Ford HealthCare.
For health.